All righty, welcome to Health a Second Opinion, and just here to have another good conversation about literally the latest health guidelines, because so many people are being overwhelmed yet again by the latest CDC guidelines that were announced, and it's brought up a lot of questions to which I'm being faced with here in the office. And it's that, well, I was vaccinated, a lot of these people will ask, and they'll say, but now I'm being told to wear a mask, and that means that I'm still able to catch this and maybe be able to give it to other people. And it brings up the level of anxiety and the awareness that things aren't what they seem, and things might not have been conferred as well as those that have been vaccinated would hope. And so we want to do something here. It was really prompted by the weight call line here on Humana. I was there checking insurance today and literally heard this on the Humana Live. It was their rolling thing while we were there. We care about your health and want to ask about your medicines, and want you to ask, are you getting the most out of them for your best life? And it was infuriating, to say the least, to have the suggestion that a person coming on the line to help you manage your medicines was going to help you get your best life, when in fact everyone in the world of real healthcare agrees that not having to be on medicine and being at your optimal physical, mental, and social well-being, not the absence of disease or infirmity, the definition of health, is your best life. So the insinuation that making your medicines better or anything outside in the management of your health is just the absence of disease or death is absurd. And so I'd like to give you an example. What about switching the mindset to literally helping people get off of their meds? What about reversing disease? What if the standard of care was not to manage diabetes, but to reverse it? What if the standard of care was the reversal of heart disease? What if it was the removal of the cause of the pain, not treating the pain? What if the standard of healthcare was real healthcare instead of disease and treatment, symptom treatment? That mindset switch right there cannot be implemented today on a national level, but it can be implemented on a personal level. Personally for you, your family, and that's where it begins. And so with these latest guideline announcements, I have to revisit the standard of real health care to which we are delivering here in every Max Living office around the country. Is about dealing with the cause of a problem. And so one of the things that's framed inside of this, I'm going to go through and give you an example of Alan, who has given me permission to talk about him and his process that he is going through. And we've talked about Alan in the past, and his getting off of diabetes medications, and he's under the supervision of his MD, and he's just been constantly implementing the very thing that we talk about, which is the 5 essentials, and how that it has taken him on a journey to which we're going to be talking about his reversal of stage 4 liver failure. So this is awesome. Really? Do most people even know that's possible? I know you might be going, what? Really? Never even heard of that before. But it could be the standard of care. So many people are thinking about building up this Delta variant and the next wave, and the latest CDC guidelines illuminating the holes in the conferred definite, immunity, bringing to light more of the original text, which was reducing the risk of death. And so we want to talk about what's guaranteed to work 100% of the time, all the time. It's going to help you be healthier. And that is the mindset of trying to be healthier. Literally looking at things from the fact that the number one comorbidity associated with the highest risk of severe illness or death, and it doesn't pertain to just what we're dealing with today. It pertains to all infectious diseases, in that the healthier the host, the more likely the outcomes will be good. The sicker the initial host is, the person who's infected, the more likely bad outcomes, severe illness or death. So to get back to dealing with the cause and focusing on the reduction of the cause of severe illness or death, we must get back to improving the health of the host, us. We need to spur the national movement to defeat the number one comorbidity, which is obesity, and complicated. And most of those people, especially with severe or morbid obesity, had diabetes and heart disease, the other major comorbidities. And so when looking at those things, the reason that they all go together is because the same lifestyle that creates one creates the others, and the person is simply manifesting their version of the symptoms associated with that lifestyle. It's their heart disease, their diabetes, their obesity, it's the list of symptoms to which their body is expressing because of its lack of ability to deal with the lifestyle burden that is upon them. And so the number one way to frame this is that a given is that every human being would be better off from the moment they're born to the moment they die by having an optimally functioning nervous system. The connection between the brain and the body is the spinal cord and the nerves. Spinal cord and the nerves, and the nerve roots, I should say, exit the spinal column. The 24 movable vertebrae in the adult spine exiting, going out to all the organs, and literally spurring them or giving them, drop the remotes, giving them their information for how they are to operate in conjunction with the whole to optimize function, have homeostasis, express health, however you want to categorize it. The innate intelligence, our life force, using that central nervous system to be the greatest connection, the fastest connection to animating and spurring the changes to the environment, both internal and external, to approximate homeostasis at all times, under all stresses, whether it be from challenges from the environment, like infections, and or temperature changes or exercise changes or whatever it is. It's your central nervous system that's controlling and coordinating those changes. So an optimally functioning spine would allow that to happen with less resistance. Better function of the spine allows better function of the nervous system on the inside. That's allowing the maintenance and continual regeneration of homeostasis back to its perfect. That's what gives people the best chance to have health. So number one thing is that, every single person needs to find their chiropractor who will take care of them and their children and their grandchildren and their parents and their whatever, to the best of that ability. Not to deal with the pain and the problems that come along with subluxations or misalignments of the spine, but literally helping guide the spine and teaching that individual how to get their spine back into its optimal alignment so that the nervous system can optimize health. Right? That's got to be step one. Step two is the mindset that says that I am going to approach my life from the mindset of reaching for the optimal, the best, and then optimum function, my health. And then looking at things and saying, okay, what can I do as an example to reach that, my optimal? So giving a couple of examples, like number one, in 2020, beginning of 2020, and when everything was going on, I too, like many people, dove into the typical behaviors that are more comforting, and went from the 205 to the 215 in my weight. Well, then that put me, being 5'11", at 30 in the BMI category. So BMI 25 to 30, 29 is overweight. 25 and under is ideal. 25 to 20. Then you have the 30 and over is class 1 obesity. Class 2 obesity is 35 to 40, and 40 plus is considered severe or morbid obesity. So I was in that obesity category. I said, whoa, that's not okay. I have to get back. So what did I do? I changed my lifestyle, changed my habits, and I went down to 195, which then puts me at BMI of 27, still considered overweight. So now I'm acclimating there in my approximation of going to 180, which is then ideal weight for me. So the idea, and this is all again built on your amount of muscle mass, and there are other factors that will probably keep me closer to the 185 at my ideal weight because of the amount of physical fitness that I do and the amount of muscle mass I carry. But that being aside, so now the idea is that since we know obesity is one of the greatest, I took myself out of that category because I knew that I was already under chiropractic care and that I already performed things that help my spine function optimally. So what's my next step? When I evaluated my own health, that was the glaring contradiction. So what did I do? Took that step. So the question becomes, what about you? What's your glaring contradiction to your inherent survival potential? Your real health. How's the host doing? So back to Alan. So we have this, checking the time out here. We have, so before I tell you about Alan, the banner scrolling across the screen is your ability to reach out to this office if you're in the tri-state area. If not, look up maxliving.com and go scroll down, find a chiropractor near me, and put in your zip code, your city, or whatever, and find that person that you can go to and have an evaluation, and then find out what your spine needs are. Also, how you fit in the rest of the 5 essentials, and you'll totally transform your life, just like Alan did. So Alan, been a diabetic for many, many years, history of cancer and different things that have been health challenges for him. And so over the last many years of being a patient in the office, he's made systematic improvements in both his spine and his lifestyle. And so recently, he had been on the journey to get off of his blood pressure medications and his diabetes medications by implementing the 5 essentials, supervising that with his MD. So implementing our lifestyle changes, then measuring it with his MD's blood work and his all of the things that they were providing. So it was just like your best case scenario. And so along the way, getting off of things like Trulicity or insulin, Trulicity, and then being left with metformin, he hit a roadblock where he was stuck on the metformin. His he still required blood pressure medication, cholesterol medications, and he was at this sticking point. Well, along comes some inspiration, to which he starts having some other symptoms and other problems. He goes back to the MD, they do some more blood work, and they look and come to find out that his liver was a mess. And then the blood work led them to ultrasounds and to other things. And then it comes down with the diagnosis of stage 4 liver failure. And instead of saying, oh my gosh, and just going on to the liver transplant list like was offered, he said, wait a second, I'm alive. I still have life in me. If I take pressure off of my body could still respond. So he comes in, we have this discussion, and we implement better lifestyle practices. And basically, it was the thing that always works. Improving the type, the time, and the tempo of his exercise, and the amount, of course, right? And then changing his nutrition to not a managing it, diabetes, but to a reversing it, to allow enough pressure to come off of the pancreas so the pancreas could heal and regulate, and then regulate the blood sugar and the metabolic syndrome that he was having. And by doing so, in 6 months, he's lost 60 pounds. And it's amazing. He looks amazing. He feels amazing. And his energy levels are amazing. And he goes back to his MD. And just recently, it's happened this week, he comes in and he's all excited. He says, I get to tell you that what we're doing is working so much. Yeah, I've lost the 60 pounds. I'm at the weight that I know I need to be at. And my MD is so impressed. And he's never seen it in his practice before that someone in my age, 60 plus, could actually lose this much weight, period, much less as fast as I've done it. And the pressure on my liver and the swelling is shrinking. It's getting smaller. And my enzymes, my liver enzymes are now like right at normal. And I'm scheduled in a year to have this other procedure where they literally look at the fibrosis of it and all of these things, but the blood flow tests of blood exiting and that kind of things that they could do, that's all great. It's working great. So in the meantime of all of this, he then gets to stop and say, oh, by the way, I'm off my metformin. The last of my diabetes medications is gone. So it's high-fiving and laughing and just, then it's overwhelmingly weighted. I tend to do this, and I sometimes have to apologize for it. I can celebrate for so long, but then I have to look at the bigger picture of things, and it made me want to cry about how other people aren't getting this. That it's not the standard of care that allows them to have the same potential as Alan. Because the potential is there. The care isn't, but the potential in the human being is there. And so that's why we do these videos. That's why we're so outspoken. That's why Max Living. It's the mission to remove the cause of disease, dis-ease, a lack of harmony in the body, so that the body can heal. And so that lifestyle things that we did with Alan can be done with any person at any stage to take them from where they're at to where they need to be. The 5 essentials, of course, core chiropractic, nutrition, exercise, detoxification, and the mindset that it is possible for this creation, this human body and the innate intelligence within it to heal it, regeneration, if it is found in time. If the cause of the problem is found in time and we have not reached a point of limitation of matter in which this finite substance that we're made out of that does have a shelf life and time and all these other things that the internal soul, innate intelligence stuff does not have that same property, but the matter does. If we can reach it in time for that innate intelligence to get enough of the matter to regenerate, reanimate, and remove the stress, the body will heal. Just like if you stop picking the scab on the cut. If you remove the burden on the liver heals if you get it in time. just to follow with the Alan example. So I thank you, Alan. I thank you. I'm so thankful for you and allowing me to be a part of this process to which you've gone through, to be able to provide yet another example of how it is possible for people to heal. And then we need to get back to that national vision, and we have to start personally, and then with our family, and then with our church, and then with our business, and then our employment, and then with our community, and then and we just keep stepping out into the nation to where we raise this mindset, philosophy that says, this paradigm that says it is possible, and that the nation will have better outcomes, and there will be less hospitalization, and there will be less severe illness, there will be less disease if we help the people be healthy. So the conversation needs to flip the script from who else is going to save us and what do we need to do outside of us to create barriers between us and the environment. And then it needs to switch to what can we do to improve our internal environment. Last year for me, it was losing 20 pounds. What is it for you? Is it the drive-through? Is it is it obesity? Is it diabetes? Is it heart disease? Is it all of the above? Is it your mindset of fear? Even in the latest, I was reading it just before I came on the show, literally the latest CDC guidelines and them saying that even the vaccinated need to wear a mask in indoor spaces, says that the incidence is low of transmission outside. So even the worst of the forecasters is saying the incidence is very low outside, so get outside. Get outside in the fresh air, get some exercise, change the mindset to saying, I am powerful, I can help improve my outcomes by improving myself. And then do whatever it takes you to feel comfortable to be in an indoor environment, in that Max Living office. If you're local, there's the number, shoot us a text, call. If you're not, look us up, maxlivingon.com, and find one near you, and have a doctor on your team that is supporting you and your family and your community and anyone that you can network them with, to be able to allow them to approach their real health. Not the Humana version that says, hey, well, if you manage your medicines, then you're going to have your best version of life. No, the best version of life is not needing any of those medications. Let's get back to a real best. Optimal physical, mental, social, I would add spiritual, well-being, not the absence of disease or infirmity, the definition of health. And if we can change that table conversation at home and at the next event, and if we can change it at work, and we can change it and we say, hey, someone asks you about your, are you, vaccinated? You can say, well, that's none of your business, HIPAA, Constitution, whatever. You can use whatever language. Yes, you could say yes if you are. You could say whatever you want to say. You could say this and then say, but the real conversation should be about what can I do to improve myself? What can I do? What do you think? What are you going to do? How are you improving your health? Do you know about the 5 essentials? Are you losing weight? Are you getting more sunshine? Are you getting more exercise? Did you quit the fast food? Did you, whatever that is? These are the things that we can do. And so looking here, let me make sure that this person is, who's texting me isn't texting in questions. I felt a little bit better of that tone. Okay, yes, they are. Okay, so speaking of they're letting me know that the tone of this is good. They were saying that they felt that. So when I look at these things, again, we're running out of time. We're at this 25-minute mark, and so I want you to understand that the latest health guidelines, to wrap this up, are that you will be better and have better outcomes against any variant of anything if you are better. So what are you going to do to improve you? And if that's your mindset and that's your focus, then you will have better outcomes, not just with what we're dealing with nationally, internationally, but every day in every aspect of your life. You'll have a better marriage. You'll have a better relationship with your children. You'll have a better relationship with your church, your employer, your everything, because you will be better. Thanks for tuning in, and look forward to seeing you next time here on Health Second Opinion.